Estimated 29 million people are living with diabetes in the U.S. Another 7 million have it and don't know it. Those with diabetes don't always test their blood sugar, which is vital in managing and treating the disease. And Dr. Bill Polonsky is a psychologist and certified diabetes educator, and he joins us with more on the latest technology and tips for managing diabetes. Good morning to you, Doctor.
Good morning. I'm glad to be here.
Thanks for being here. You know, we want to know a little bit about these studies that you had. I just want to know, is it true that many who have diabetes don't take care of them because of psychological or emotional reasons?
Yeah, unfortunately, that's true. It's, diabetes is work. It's it's stuff you have to do every day, and you have to make and maintain lots of behavior changes. And for any of us, it would be hard to do over the course of time. That's why we see this happening. And the biggest problem we see, one of the biggest problems, is that we know lots of folks don't check their blood sugars as often as they need to do. And that's really what our study was about. What we did is we looked at over 800 folks with diabetes, and what we discovered is 3 major reasons that contribute to why people don't check very often. One is they just see this blood glucose monitoring as burdensome. Second is they found that testing just seemed kind of pointless. It seemed like these numbers were going up and down for no earthly reason. They were confused about what these numbers meant. Why bother? And the third factor we saw was that people felt like the blood glucose numbers they were seeing were actually discouraging and demotivating. It felt like their own actions weren't making much of a difference at all. And by the way, for those of us who don't have diabetes, it's sort of what we can feel like if we're on a diet and you're weighing yourself in your bathroom scale every morning, the numbers never change. It's easy to get discouraged. And we see how all these factors fit together and why it makes so much sense that so many people struggle around blood glucose monitoring.
Well, I think that's a great analogy because so many of us have had that frustration, that we feel. So what do we do about it? How do we help fix this?
Well, first of all, we want people to know that it is, in fact, really important to be checking your blood sugars on a regular basis, to have some agreement with your doc about how often you should check and when. It can really make a big difference to help people getting on track and staying on track with their diabetes. And what we're also seeing is there's new tools and new technology that can support patients' best efforts and can address some of these emotional issues that we discovered in our research. One of the things I'll mention is there's a new tool called the One-Touch Vario blood glucose monitoring system that really does some really cool things that address some of these issues. For example, it has this color-coded ranging indicator so that when you see the blood glucose number that pops up on your meter, it actually has a color attached to it. And that color can help you to know whether your number is in the range you need it to be, or whether it's too low or whether it's too high. And again, for the 1/3 of folks with diabetes who are confused about their numbers, this can help you to know some very important information about what this number actually means. The other cool thing I like about this new meter is it collects your blood glucose numbers over time, automatically without any work on your part at all. And it presents you on a regular basis with positive feedback to let you know that, gee, your numbers have been in range. Congratulations over the past few days. Or, well, they've been out of range for a while, but now they're coming back into range. And what our patients need, in fact, what any of us need to keep up any kind of tough behavior change, like blood glucose monitoring over time, is to be congratulated. And that positive feedback can really make a difference. We want to see physicians doing this more, and how nice that we have tools and technology that are providing that with patients and making it easier for them.
I think making it easier is the key, as you mentioned. What other advice do you have, and does it differ between type 1 and type 2 diabetics?
Well, there is different information, but the bottom line is we want anyone, whether they have type 1 or type 2, to please make the effort to get educated about diabetes. And from my perspective as a physician, it's important, as a psychologist, it's important to remember, don't do diabetes alone. Reach out to make sure you have a healthcare provider you really feel is on your side. Get your friends and family involved. Join a support group. Go online. But when you have people in your life who you really feel are rooting for you and rooting for you in the right way, it really can make all the difference in the world.
Mm-hmm. And just having, as you mentioned, that feeling of having control over your health can really give you peace of mind.
Oh, yeah. And by the way, we also hope that if people want more information, first of all, they want more information about diabetes or about this new meter, all they have to do is go online and visit onetouch.com. If they're interested in more information about stuff I really am worried about, the emotional side of diabetes, and so few people really know much about this, I encourage them to visit the website for our institute, the Behavioral Diabetes Institute, at behavioraldiabetes.org. And I hope this information will be helpful to folks.
Thank you so much, Dr. Polonsky. We appreciate it.